Hey there, this is Jamarcus here, and in this video I'm going to demonstrate on how to instruct a patient on how to perform a sputum collection at home. Let's get it started. Sputum specimens are used to diagnose certain conditions such as cancer, bacterial infections, viral infections, fungal infections, and even tuberculosis. And with that being said, if you are working as a medical assistant and you're dealing with a patient who has active tuberculosis, you must wear a N95 respirator mask. All right, let's get on to how we should perform a sputum collection at home. When we begin to look at tuberculosis and sputum tests help doctors understand if your sputum contains any TB germ or any tuberculosis germ. Sputum tests play an important role in TB diagnosis and treatment. Specimens for cultures are always collected in sterile containers. When instructing our patient to take a sputum specimen from home, we're going to instruct our patient, do not collect saliva because saliva is from the mouth. We're also going to instruct our patient to not collect any phlegm from the nasal passage or the throat lining. Sputum comes straight from your lungs, and so when we are collecting that sample, we're going to instruct our patient that they must cough up sputum from deep inside the lungs. With that being said, it must be important for your patient to identify what's the difference between saliva and the difference between sputum. Saliva is normally thin and nearly clear. But when we begin to look at sputum, sputum is thick and is produced from the lungs. It is best to collect sputum specimens first thing in the morning because when you sleep, sputum collects in that lungs overnight. Before coughing up the sputum, we're going to instruct our patient not to eat, not to drink, not to brush their teeth, or even use mouthwash. All right. To start, we're going to ask our patient to remove any dentures if there are any. Rinse your mouth with water which has been boiled. Make sure not to use tap water. And we're going to ask our patient to take 3 or 4 slow, deep breaths. Deep breathing helps loosen those secretions. It helps loosen the mucus that in that sputum that is from your lungs. All right. At the top of the 4th breath, we're going to ask our patient to cough out the sputum from their lungs. We're going to ask them to spit that sputum into a collection cup and repeat the process until at least 1 teaspoon of sputum is collected. We're then going to ask our patient to screw the lid on tightly to prevent any leakage. Place the container into the plastic bag provided. And if you're unable to send the sputum sample to the clinic immediately, place the sputum collection in a refrigerator and make sure that it's not the freezer. And that's how you collect a sputum collection. Thanks for watching, you guys.